So what are the things that we generally consider? The technique, the segments, what is the type of stenosis, central or lateral, whether the instability is there or not, deformity, scoliosis is there or not, patient factors, and the surgeon's expertise. So what do we mean by technique? So, as I discussed right now, if the patient is having a through and through central compression, so through and through central compression, you will have to knock down the spinous process as well properly. Whenever, especially there are patients with caudai equina, because we don't want the pressure to increase over there at all. Similarly, even if the patient is having central stenosis, what other thing that we can do is over the top decompression. What is over the top decompression? We go from one-sided laminotomy is done. We remove the base or the central part of the spinous process from inside and go on the opposite side via this over the top decompression. So this is how even central area can be decompressed without removing the spinous process. Why not removing the spinous process is important? Because spinous process has got multifidus muscle attached to it, which is a key muscle that helps us in rotation. And whenever we talk about minimally invasive techniques, so these multifidus muscles are very much important vis-a-vis keeping them non-compromised and keeping them in place. Segments, depending on how many segments are, how many area are there that are involved multiple level. Whenever you generally are having even up to 4 levels, just a decompression can be done. Central type of stenosis versus lateral stenosis. So whenever there is lateral stenosis, a lot of lateral stenosis, in that you may even have to consider knocking down the facets. If you're knocking down the facets, in that case you will have to do a fusion. Instability, if the instability is there, you can't just do a decompression, you will have to fuse also. Deformity, when there is a degenerative scoliosis multiple level, so you will have to do a correction if required, if ever it is going to increase, and do a decompression thoroughly. Patient factor, if the patient is having instability, pain, if the patient is obese, if the patient is having factors which are going to suggest you that it is going to recur, in that case fusion may be better. Surgeon's expertise, as per the comfort of the surgeon.